This segment of DelmarvaLife is sponsored by Salisbury University.
A nationwide shortage of skilled healthcare workers, such as nurses and social workers, is hitting rural areas hardest. And that can be bad news for rural populations here on Delmarva. But Salisbury University's College of Health and Human Services is responding to that need. And they're doing it with a pairing of rigorous academics and hands-on experience. Here on the peninsula, access to care can hinge on one thing: people. Salisbury University's College of Health and Human Services is building that pipeline, combining classroom rigor with real-world training to keep providers here at home.
What sets our program apart from others is that we have faculty who are real-life practitioners. They work, they practice what they teach, they conduct research, and they're really devoted to making sure that our students receive a first-rate education so that they can enter the workforce and fill a need.
That need is acute in rural regions. Specialties are harder to staff, appointments harder to get. SU's nurse practitioner pathway is answering the call with a 100% licensure pass rate.
I think that says that our practitioners that teach in that program are very dedicated. They want the students to be successful, so everything that they teach is based on the latest evidence, so that the students can go out and take care of patients, providing that #1 care.
Flexibility is baked in. Courses blend asynchronous work with live online sessions, so working nurses can keep their jobs, care for families, and advance their careers.
So our programs are fully online. They allow the students to have a little bit of independent work. So some of the work is done completely asynchronously, so that they can log on and complete the work at their own pace. Other is done synchronously, so that they can be on there with a faculty member at the same time with other students. It allows them the flexibility to continue with their life, to have their children, their family, and to practice.
And it's not just screen time. Graduate nursing students log roughly 350 clinical hours, paced over 2 to 4 years, matched with preceptors across Maryland.
We have partnerships with hospitals. We have partnerships with many clinical agencies all over the state of Maryland.
The impact is already visible.
We have students that have been very successful. They've gone into leadership roles, so they have become leaders within hospital systems and other organizations. We have students, our graduates, that have gone on to open their own private practice, which nurse practitioners can do. And we've had others that have even come back to teach with us, because we always need the educators as well, because there's also a shortage of nurse faculty.
Zoom out to the full college, and the mission is the same: meet the communities where they are.
The biggest challenge in human services in our community is just access to providers, right? Being in a rural, remote location, there's always a shortage of providers relative to need in the communities.
So programs are designed to travel. Take social work, Salisbury University's largest graduate program.
And we really try to be intentional with how we deliver. For example, our social work program, our Masters of Social Work, is delivered in 4 regional locations, as well as our Salisbury location, as well as an online synchronous option for people that don't want to disrupt their daily lives and their work patterns.
Partnerships power it all. Fieldwork and clinicals that match classroom learning with hands-on practice. And there's a bonus: when you train here, you tend to stay here.
Our partnerships with fieldwork and clinicals are extraordinarily important, not only to provide our students the best matching of clinical expertise of people that are doing it in the field and matching it with what they're learning in the classroom, but it also allows us to train students in rural communities, because typically when you train here, you stay here, and that's really important to us at Salisbury, that we meet the needs of the Eastern Shore.
Salisbury University is shaping advocates and problem solvers, professionals ready to close gaps, improve equity, and elevate care across Delmarva. And Salisbury University is one of only a handful of institutions nationwide to offer a social change and leadership specialization in its Master of Social Work program, preparing students not just to serve others, but to shape the systems that serve us all.